Hello, thank you guys for joining us. We're going to be doing Creating a Culture of Consent today. It's going to be presented by Helpline Youth Counseling and our Adolescent Prevention Services. My name's Gabby, I'll be one of the presenters, and we also have Jada and Vanessa who will be presenting with us today.
Hello, everyone. My name is Vanessa, and just some brief topics that we will be covering today. We'll be talking about current drug trends and the role of substance use in sexual violence. We'll also be touching on understanding the correlation between substance use and trauma. And lastly, we'll focus on finding healthy coping mechanisms and alternatives for healing.
And hi everyone, my name is Jada, and we want you all to be aware that we will be discussing sexual assault, domestic violence, intimate partner violence, and substance abuse today.
So we'll go ahead and get started with what is sexual assault. Sexual assault is something that can take many different forms, but the term usually refers to sexual conduct or behavior that occurs without explicit consent of the victim. There are a couple signs you can kind of look for when you're kind of trying to find out if either you're involved in sexual assault, if you've been a victim of sexual assault, or maybe you're worried about someone you know who might have been a victim. Sometimes if their partner has strict control over their finances, social life, or appearance, this could be a sign of domestic partner abuse or intimate partner abuse. They could also need constant communication. Maybe they have some unexplained bruises, frequent cancellation of plans. So usually when they're in kind of an abusive situation, their partner wants to try and isolate them, which is the last bullet, fear and isolation. And sometimes a consequence of isolation is canceling plans, kind of going away from a friend group, just being more and more alone. Because the more isolated a person is, the easier it is to control, instill fear in them, and keep them from reaching out for help. So those could be some of the signs that you might see for someone who is either in an abusive relationship or who has experienced sexual assault or any of the other things like that. We do have a couple of little facts at the end of each PowerPoint slide. So this one says females ages 18 to 24 have the highest rates of rape and sexual assault, and they're 3 times more likely than all women to experience sexual violence. So we'll read those facts as we go on through the rest of the slides as well. And then just a little bit about who the perpetrators are. Sometimes there's a misconception when it comes to sexual assault that it could just be some random stranger that you saw on the street, or you were a victim to someone who was targeting you, but you didn't even know who they were. But that's actually not true. Usually 8 out of 10 times the perpetrator is someone that the person knows. So it could be a family member, a friend, an acquaintance, someone that they're familiar with. And we have another fact down there: 1 in 5 college females report experiencing sexual assault. So that could be by someone that they know, maybe someone who lives in the dorms with them, a friend, a classmate. So that is something just to keep in mind. The perpetrators are usually someone that the people do know.
So what is consent? Consent is agreement between participants to engage in both sexual and non-sexual activity. Consent is also clear and freely communicated. So for today's theme, we want to discuss what consent is and what consent is not. So consent is not the absence of a no. A clear no is not required. You can read body language, other forms of cues, discomfort, or feelings of coercion as well. Assumptions. Consent is not based around your consumption. So prior encounters that you may have had with participating parties does not mean that you assume that they are consenting to an act. Consent is also not coercion, harassment, or manipulation. You should not coerce someone, use blackmail or violence to force someone or coerce someone or make them feel manipulated into participating in a act with you. And consent is also not only in reference to sexual acts. So you should ask for consent whenever you wants a sexual or non-sexual form of communication and contact. That includes hugging, kissing, conversations, sending explicit text messages, etc. So what is consent? Consent is verbal. It is a clear yes. It can be established. It needs to be established during every encounter. That means that regardless of how many prior encounters you may have had with a person or people, you must consent and have the other parties consent to that encounter. Ongoing process. So consent can be revoked at any moment. That means that you should constantly be checking in with partners to make sure that that consensual act is consensual from start to finish. And affirmative expressions. As I mentioned before, you can have a clear yes, but it may be met with some body language that you do not, that shows that they are not comfortable. So affirmative expressions means that the body language and the nonverbal communication that they give is in alignment with the verbal yes that they consented to. So how does this connect with our adolescents? When we are discussing consent with teens and when teens are learning about consent, things can become very confusing and complicated for them. One of the reasons why is because as teenagers, as minors, their interactions with parents, guardians, and other authority figures can really shape the way they understand consent. If you are raised to believe that consent, that you must consent to things because of an authority figure, you may have blurred the lines between what is consensual and non-consensual. Another example is the use of substance during that time equals a lack of consent. As an adolescent, you cannot consent to sexual acts. You are not legally bound to consenting to sexual acts, as well as when you are under the influence of any form of substance. Thirdly, the ideas of fear, shame, guilt, and pressure. There are many misconceptions around what consent is, and oftentimes if you are not consenting to something, or if you do consent to something and then later revoke that consent, there can be a lot of pressure and guilt around that particular act or the choices that you make. And lastly, cultural references. Pop culture oftentimes perpetuates a lot of stereotypes and misconceptions around consent, such as no really meaning yes, or a woman or man or participating party playing hard to get. And those things are quite prevalent in our society. And as consumers of content, as many adolescents are, this can confuse what they understand consent to be.
So now we'll be shifting gears a little bit towards sexual assault and substance use in teens. Like Jada previously mentioned, when substances are involved, it is a lack of consent. So we'll touch a little bit more on that. There is a correlation between experiences with sexual assault and substance abuse in adolescents. Substance abuse is a risk factor. That's another point that we will be elaborating on in the next slide. Females under the age of 18 make up to 81% of reported adolescent cases. So that shows us two things. It shows us that females are at most targeted, and as well as 81% is a high number that doesn't take into account all of the cases that go unreported. Lastly, teens with drug problems are 18 to 21 times more likely to experience sexual abuse. So the role of substance use in sexual violence. There is a range of possible connections between sexual violence and substance use. So substances could have been used willingly or unwillingly prior to the assault. It could have been used during the assault or even as a coping strategy in response to the trauma that the survivor or victim is experiencing. So each of these possibilities could potentially cause different responses and reactions by the victim and by society at large. Secondly, both substance abuse and sexual victimization carry a great deal of social stigma. So it is a stigma already to come forward with your story. It's a very difficult process for a victim to open up about their story and what happened to them. But adding on that substance use may even add on to that stigma as well. When a survivor experiences both, it can be very difficult to overcome. So that might be due to religious, cultural, or even familial beliefs that may deem alcohol or drugs, whatever substances, inappropriate. We also do live in a society where the drinking age is 21 and over. So if someone is under that age, they might fear to come forward and share their story. This can definitely silence and discredit victims or survivors even further, and may even cause them to increase feelings of blame or shame and isolation. Lastly, there is a reciprocal relationship between sexual violence and substance use. So it is a complex issue because sexual violence may be a precursor or even an effect of substance use, abuse, or addiction. For example, a prior history of victimization may predispose someone to use drugs or alcohol or even abuse it later on in life. It could also mean that drugs or alcohol may be a risk factor for victimization as well. And those who are under the influence of drugs or alcohol are even more vulnerable to an attack. Lastly, before we go on to the next slide, I do want to touch on this graph. It basically shows that teens are reporting sexual abuse at a higher rate. And so just to elaborate, females between the ages of 16 to 19 are 4 times more likely than the general population to become victims of sexual assault. And that graph basically exemplifies that. Now we want to share a little bit of a story about a survivor. So this story basically represents the correlation between substance use and trauma. We do want to highlight that the name and the age of the victim or survivor was changed to protect the survivor story. And so we'll go ahead and read it. In January 2006, I was sexually assaulted on my way home from the nightclub home in the meatpacking district of NYC. As I left the club, several limousines were parked outside, and one of the drivers called to me and offered to drive me home for the same cost as a taxi. I agreed and proceeded to enter the cab of the limousine. I believe I was visibly intoxicated. The driver drove to a remote street, got out of the car, entered the back of the limousine, and locked the door. He offered me a joint, which I declined. He smoked part of the joint, then he pulled my dress up and yanked down my underwear and proceeded to rape me. I felt trapped and helpless. I couldn't move or scream. I panicked and froze in place while he assaulted me. I could do nothing to protect myself. While I did not protest, this was not consensual sex. The next thing I can remember is walking back to the Four Seasons Hotel where I was staying, having been dropped off several blocks away. I did not report the sexual assault at the time because I was embarrassed at having been intoxicated, and I knew the police would just laugh at me like I was some young drunk girl. I also felt at the time that it was my fault for being intoxicated and making a stupid decision. But looking back, I definitely think the driver was targeting intoxicated women coming out of the club, which is quite frankly disgusting. Since then, I've been through treatment for my drinking and have accepted that I'm an alcoholic. And I've met countless women who have experienced similar acts of sexual violence. It is unfortunate that while we are in our active addictions, we cannot see that these experiences aren't our fault, that we are disproportionately targeted by perpetrators of sexual assault. But in recovery, we have the opportunity to begin to believe that it wasn't our fault and we can begin to heal. So we just wanted to share that story to basically highlight, again, the correlation between substance use and sexual violence. But most importantly, we did want to make it known during this presentation that just because someone is under the influence does not make it okay. It does not provide consent, and that it's not the victim's fault. So we definitely wanted to make that known.
So now just a little bit about some of the current drug trends we are seeing in our youth. National studies and published reports indicate that the abuse of prescription or over-the-counter drugs is a growing concern, particularly among our teens in the US. It says, in fact, people that are 12 to 17 abuse prescription drugs more than any other illicit drug except for marijuana. So that's more than cocaine, heroin, and methamphetamines combined. In 2006, more than 2.1 million teens abused prescription drugs. And the reason that this is becoming increasingly popular among our teens is because of the availability of it. They have access to it, it's free, inexpensive. They tend to believe it's not as risky as street drugs. Usually, they can find prescription drugs or over the counter drugs in their medicine cabinets at home, maybe their grandparents' medicine cabinets. If they have a sick family member or anyone in their family who's taking any type of antidepressant, maybe a sleep medication to help you with that. It's usually really easy for them to go and take maybe 1 or 2 pills without being or without drawing attention or having anyone notice. Or if we have those expired pills in the back of the cabinet that everyone forgets about, you probably wouldn't notice if someone took those. So just definitely something to look out for with their adolescents and kind of know what drugs they are abusing, because like Vanessa said, it is a reciprocal relationship, substance abuse and sexual assault. So these are just a few connections that also show the relationship between the two. So the first one says alcohol and drug use have been shown to increase vulnerability to violence through exposure to unsafe situations. That's not to say that it's anyone's fault because they were drinking or using substances. That isn't why this happened to them, but it does increase your vulnerability. And usually people who are perpetrators are looking for someone who is vulnerable because they're an easier target. So it says approximately 1/2 of sexual assault victims report that they were drinking at the time of their assault. So it just goes to show that the vulnerability piece is really there and they are targeting people who are vulnerable. So we definitely want to educate our youth on some of the dangers of abusing substances and alcohol, not just relating to their physical health and mental health, but just their well-being overall. Subsequently, victims of sexual assault may use drugs or alcohol to cope with their feelings after the assault. So many victims experience PTSD or post-traumatic stress disorder. And like mentioned before previously in the slides, there is sometimes shame or guilt that comes along with sexual assault. Maybe people are afraid to come forward with their story. There's definitely a stigma surrounding it. So maybe people are afraid to come forward. They don't know how to come forward. They're scared of what people might say or think of them, even though it's definitely not their fault. So they just don't know how to cope and they kind of turn to drugs and alcohol to numb that feeling, the trauma or the stress, because it's just too much for them. Another fact says men and women reporting sexual abuse have higher rates of alcohol and drug use disorders, more so than other men and women their age. And then the next one says rape victims are 3.4 times more likely to use marijuana, 5.3 times more likely to use prescription drugs for non-medical purposes, and then 6.4 times more likely to use cocaine, and 10 times more likely to use hard drugs. And lastly, nearly 90% of alcoholic women were sexually abused as children or suffered severe violence at the hands of a parent. So through all these different little facts that were showing the connections, it is definitely reciprocal. Sometimes the alcohol and substances came first and then the sexual assault, or sometimes sexual assault led to the coping using alcohol and drugs. So definitely want to be educated on both sides, what's out there, what's the trending drugs, what's going on, and then also the trends just surrounding sexual assault, so we can hope to decrease both sides of that equation.
So how do we cope and how do we support teens who need to cope, who have experienced sexual assault, substance abuse, and or a combination of them both? Trust and communication between the adult and adolescents is extremely crucial in helping an adolescent work through the traumas that are associated with sexual assault and substance abuse. Therapy and counseling. There are various groups as well where teens can express themselves, can find support, substance and recovery, meditation, etc. There are also hotlines and immediate forms of support for those who need to take action in that moment, and other expressive ways such as journaling and art. So part of those coping strategies is really around building healthy relationships between adults and adolescents. And while this particular presentation focuses on adults and adolescent relationships, these are forms of healthy relationships that can work between adults, adolescents, and just about any other age group or group dynamic. And so the first thing that you want to do as an adult supporting an adolescent is establishing trust. You want them to feel like they can trust you. You want them to feel like they would be excluded from harsh punishment, victim blaming, and judgment. And you want to do that because an adolescent is more likely to uh, uh, hide information from an adult if they feel that they would be punished or judged or ridiculed for their actions. Also, you want to establish clear and healthy forms of communication. So you want to always communicate with an adolescent around the things that they're experiencing, the things that they have experienced, and some of the traumas that are associated with it. You want to make sure that all parties, both yourself and all of the other participants involved, feel comfortable and safe relaying information back and forth to one another. And this is most especially important when we're talking about sexual assault and substance use, two things that as an adolescent, as a minor, are technically illegal. Substance abuse and consenting to any form of sexual acts as an adolescent is something that we understand through the law to be illegal. And so this can really make communication and trust challenging for a youth.
So just a little bit about who can help in these situations. Definitely everyone can help, the more the better. Changing and creating a new culture takes all of us. So like mentioned, there's a lot of shame and guilt kind of surrounding sexual assault and coming out with their stories, as well as teen substance use and adolescent use. It's kind of a topic that people may feel uncomfortable talking about or educating their kids about. But definitely the education is a huge piece. Community and allied support for survivors is critical to their healing process. Chances are you probably know someone who has experienced sexual assault. It's an issue that affects all of us. It does not discriminate. It reaches every level of society, including families, offices, neighborhoods, schools, places of worship. And there's definitely a need for allies to stand by survivors and break down those walls of silence around the issue. And some people may ask, well, how do I become an ally? How do I advocate for this community? Becoming an ally, there's a lot of different things that you can do. One of them is learning more about the myths and realities of sexual assault. So definitely that educational piece, breaking down the myths, helping people come forward, realizing that it's not the victim's fault, that there are things they can do about the stress that they're feeling. They don't have to cope with substances or alcohol. And then you definitely want to understand the impact of assault on a person's life. So if you've never been through it, you may not completely understand what they're going through, but you want to be empathetic. You want to try and put yourself in their shoes, or just educate you on what happens to survivors or victims of sexual assault, so you can further help them to maybe process or cope, or any way that you can help them with their trauma.
Yeah, and just touching off of that, just some more ways that you can show your support. Number one is to always believe victims who come forward. You can do this by making small phrases and statements such as, "I'm sorry to hear that. This is not your fault and you are not alone." So statements like this pretty much validate the person's experience, their story. It truly makes them feel heard and like you were there to listen. So our primary goal with this presentation is to encourage viewers to practice, these statements and making victims feel like they're believed. Secondly, donations. We are living through a pandemic right now, and so this might not be, your capacity, but if you do have a few dollars to spare, there are always nonprofits, funds, victim funds that are collecting donations to expand services for victims and survivors. Number three, you can start a call to action. So if you are more just encouraged to contact your representatives, participate more in legislature, creating change in your government or creating change in your cities. You can definitely participate by creating a call to action. Number 4, continue to share, educate, repost any Me Too movement or momentum. So social media is a huge tool that we all use. So we can definitely use it as a way for continued education, just educating our family, educating our peers about the subject, as well as a lot of victims and survivors that do share their stories. It's always great to, with their consent, continue to repost and make them feel heard. Number 5, increase awareness in your community. And number 6, shop in ways that support victims and survivors. So this is, for me, a new trend that I've been seeing in some companies, even small businesses. What they'll do is they'll incorporate a portion of their sales and a portion of their funds to, again, local nonprofits or local services that help victims and survivors. I do want to go ahead and read that last box. Other ways that you can show your support to sexual assault survivors is by devoting a personal responsibility to self-educate. So continuing that education around ourselves. You can always volunteer, you can organize and lobby your representatives, as well as participate in legislative efforts. We do have available some resources located in Los Angeles area. So if you want to take the time to put pause on the video for this slide, feel free to take a screenshot of the resources that are available. We did provide various hotlines in the area. One of the main hotlines to report sexual assault is through Peace Over Violence, which is a well-known nonprofit and crisis center. We also provided methods for reporting. I do want to highlight that reporting is totally up to the victim if they want to come forward, but if that is an option that they'd like to do, we did provide several resources in the LA area. We also provided sexual assault response teen center. So this is a really useful resource in LA. There are team centers and specialists that go immediately at the site or location that it happened. So if someone is in a crisis situation, these are the following resources, phone numbers that they can call. We did provide some therapy referrals and other victim services, lastly, as well as some local shelters in the area. And then, of course, if you are an Orange County resident, we did want to provide some more resources. Some of the resources are pretty similar, such as national hotlines, methods for reporting, but feel free again to put a pause on this slide and take a screenshot. We also mentioned local hospitals in the area that provide evidence collection and treatment. We provided more shelters and, of course, more therapy referrals and victim services in that area. And lastly, these are the resources that we used to provide content and education for you today.
Yeah, so thank you guys for joining in and watching. We have our emails listed here, so if you have any questions or if you'd like further information on anything, definitely feel free to reach out to either myself, Vanessa, or Jada. Or if you weren't able to really screenshot any of those resources or pages, we can send them out to you via email. So if that's something you would like, definitely feel free to reach out. But that's it for today. So thank you guys so much for joining us, and we will see you next time.
Thank you.